Hi, and good afternoon, everyone. My name is Dr. Gauri Kulkarni. I head the medical operations at MediBuddy Docs app, and today we are going to have a great discussion on Diwali and what all it can bring to us when it comes to our health. I know that this is the time of the year which is more hopeful for all of us. 2020 has been quite difficult with the COVID coming in. A lot of us have been suffering at many levels, be it at physical, mental, spiritual, social. There's been so many changes in our lives, and that we all look forward to festivities as the time to get together, meet our near and dear ones, share happiness, share hope, share a lot of togetherness. But because of a lot of things that are happening around us, we need to also know what we can do to ensure that we keep ourselves healthy and protected. That is what we are going to discuss today. And what we will be talking about is everything about what we can eat, what we can do to ensure that we keep our sugars under control, especially for people who are already known diabetics, what we can do in this era of COVID 19 uh, and to ensure that we are keeping ourselves safe, we are keeping ourselves protected, and of course, any of your questions that you would want to ask and clarify your doubts regarding your health. So do bring on your questions and let me know so that I would be able to try and address them to the best of my abilities. So let's start off, right? Diwali is a time, as I said, this is a beautiful time. We all celebrate, we all, have become very hopeful. There's a lot of pleasure around us, and festivities bring in togetherness, a lot of people meeting each other, a lot of, food around. A lot of our culture is around how we eat and what kind of different, sweets that we prepare. And also it also brings in a lot of gifting and a lot of meeting other people. So what are the things that we can do considering the COVID-19 situation? One, from a personal perspective, I would say, like from one within us, for each of us, right? We need to definitely ensure that we are taking care of our health, right? Now, you might be somebody who has no illnesses, right? You might be somebody who doesn't have diabetes or any of the chronic diseases, and that's great, and I would congratulate you for that. But it's still important that you take care of your health, because your immunity is very, very important, and you take care to ensure that you are eating right, exercising enough, de-stressing, sleeping correctly, getting some amount of sunlight, drinking lots of water. So doing all the things that are right to keep your health up and about, to ensure that you don't fall sick. Now, if you are a known diabetic, of course, it's even more important that you take care of yourself, right? Now, Diwali is a time that there's a lot of preparation of interesting dishes in our homes, and that is something as a part of our tradition and culture that we follow. And it's absolutely something that we all do. And I do understand if somebody is diabetic, they tend to, this is the time that they would want to indulge. And this is the time that we would try to figure out how we can make our options of eating better, how we can get the right kind of food for ourselves, right? So a lot of sweets are prepared. I'm sure that all of you have different kind of cuisines. Of course, throughout India, in different parts of India, we have different kind of sweets that are prepared, especially for Diwali, and which are which are very specifically prepared for Diwali. Now, it's very important that you ensure that if you're a known diabetic, you take care of the way it is prepared, right? So maybe using less sweet, like less sugar, using less amount of jaggery or any of the sweeteners that you use. Try to use natural sweeteners, right? So there are fruits which are available, which are themselves add sweetness to anything. So you might want to prepare dishes based on fruit, right? So, or using of certain, say, vegetables like, say, carrots or beetroot, which are known to be sweet in their taste. So, using, natural forms of, say, sweetened products to ensure that you do have your sweet and you do satisfy your sweet tooth. But at the same time, you get that sweetness from things which are more natural rather than the use of sugar, which is definitely not good, right? So that's something that you can do. This is also a time that people get together a lot, and because of the, one is because of diabetes itself, but also because of the COVID-19 situation. I advise a lot of my patients who are diabetic to avoid gatherings or to avoid places or meeting too many people at the same time. So that's something that you can do, or rather you could have your get-togethers in a more virtual setting. If that's not possible, then ensure that you are wearing mask at all times, so that you are, and maintaining the kind of physical distance that you would want to ensure that you're taking care of yourself. So that is something else that you can be doing when it comes to getting together. So one is the type of food that you eat. The second is the type of, when you are getting together with people or meeting people, trying to avoid it, or if you can't avoid it, then of course trying to figure out how you can minimize your risk of falling sick, right? That's very important. Now, of course, because diabetes is something that is with you all the time, I'm sure that almost people who are diabetic are also on medications. It's extremely important, especially that you ensure that you take your medications on time, you monitor your sugars correctly, and ensure that you are not missing out on your tablets or your injections or whatever that is, that whatever the medications are that are being prescribed to your doctor, by your doctor to you, right? So ensure that you have a regularity in the kind of medications that you're taking. So very, very important that you follow that and not miss them, right? So if it even if your diet has not been the best, ensure that the medications are at least taken correctly, right? The fourth thing that, of course, I keep advising this to everyone, is to ensure that you're exercising um, consistently, right? So whatever you're able to do, you need to figure out a method to find time and continue with your exercise regime, be it say walking regularly on a daily basis, to doing yoga, or doing Pilates, or any kind of exercise that works for you, but that has to be done regularly. Now, if you know that you are going to indulge in sweets, or if you know that this is going to happen, ensure that you increase or up your exercises, right? That's something that you should do. Along with that, ensure that you have a sense of calorie count that you're doing through the day, which means that, say, suppose you know that this evening I'm going to step out and say go have food at a relative's place, or we are going to have a more elaborate kind of meal that is going to be prepared at home. Ensure that your intake is restricted in the daytime or the morning, so that you are able to kind of have a control over the calorie intake that you have. So that is something that also you can do. So it's more about being aware of what you're eating, rather than amount that you have to look at, and how much you're eating, how much is the calorie content in whatever you're eating. So that is extremely important. So from a perspective of being a diabetic, I think it's very, very important of the choices that you make about the foods that you're eating, the amount and the calorie content that each of it has, the amount of exercise that you're doing, ensuring that your medications are taken on time, ensuring that you are monitoring effectively, ensuring that you're sleeping well and de-stressing, because that's also important, right? But I think one of the things that happen very often during Diwali days, and I've heard it from a lot of my patients, is that there is a chance of having alcohol or indulgence in alcohol, and I think that is something that we should absolutely avoid. And even if it is something that is going to happen, rather ensure that you have some healthy snack options along with that, instead of so that you are ensuring that your alcohol is absolutely zero, or to very minimum that your intake is going to be. But that is also something that you have to take care of, to ensure that your sugars are under control. But of course, there's a question which has come in, is that my father is facing diabetes issues, if there's any diet plan, right? Absolutely. So one of the first, a few questions that I would ask you is, how long has your father been a diabetic? What are the current medications that your father is on? Is he on insulin? Is he on tablets for sugars? So these are important questions to ask, right? Now, from a diet plan, right, from a generalized perspective, if we had to look at that, right, see, the most important thing is that we have to ensure that we have lesser amount of carbohydrates in our day-to-day eating, right? When I say lesser number of carbohydrates, what are carbohydrates? They are a source of energy for us. Say your rice and wheat and any of the other cereals tend to give us the carbohydrates that are there. Now, reducing the number, and carbohydrates are the source of energy, primarily which we get from, and the sugar is released from there. Now, the other two sources of energy are also fats or proteins, right? Now, proteins are definitely those which are also required as building blocks of your body. So, having a high protein diet, which will also provide you definitely energy, but also help in building your body better. Also, because in diabetes, low protein levels are quite an issue, and over a period of time, if there is any kidney involvement, it is recommended that you do have increase in your protein intake. So ensuring that you have lower carbohydrates in your diet, have higher amount of protein. Now, what do you mean by protein? Protein is, say, for example, in your pulses, if you're a vegetarian, or say soya, or paneer, or any of these sources can be something that you can think of when it comes to protein. Of course, if you're a non-vegetarian food, then lean meat, say having chicken or eggs, are a good source of protein. So ensuring that carbs are less, having a little moderate to high amount of protein, definitely. Lesser amount of fats, of course, but a huge importance on having enough amount of fiber in your diet, which means, say, having lots of vegetables, all kinds of vegetables, really. So anything and everything. They give you high fiber. They give you a sense of satiety. They fill your stomach up. So that's also something that you can do, and ensure that that will also help in reducing your carb intake, basically. So that is something that can be done. Now, there is absolutely no to anything which is obviously a sugar, right? When I say obviously a sugar, it means that um, you look at it and you know that it is sweet, right? So be it, say, anything from, say, chocolates to burfis and pedas and laddus, to, say, pastries, or anything which is on the face sugar or sweet, right, is a complete no. It's best to avoid it, right? Because that will only increase the need for medication, and of course, over a period of time, it will also increase the complications due to diabetes. So I think it's very, very important that we take care of this, right? Definitely, there's a lot of myth behind people saying that, oh, we should not eat fruits. There's no harm in eating fruit, right? A general principle that I tell to everyone is eat a handful of fruit a day. Okay, a handful is just about your hand, like your stomach is and your hand are mostly coordinated, or are the sizes are proportional. So just a handful of fruit a day, but that is definitely a better sweet than taking, say, sweet things with sugar in it, right? So that is something that you can do. Have your sweet tooth satiety done by fruits. I think that really works well, right? So do that. Ensure that along with the diet, it's also important that there is a bit of exercise which goes in. So it's important that you think about it and pull it up, and ask your father, currently what is his activity levels and what can be done to improve it. If there is any issue with knee problems, or if there is any issue with joint issues, joint pains, then definitely consult a doctor to take care of this, so that he's able to be more mobile and consistent with his exercises, right? So that can be done. Now, in terms of the cereals, also we tell a lot of it's a good idea to have cereals with high fiber. So having things like millets, say ragi, jowar, is bajra. These are supposed to be a little better because they do have a more fiber as compared to, say, a wheat or rice. But again, that also has to be in limited amounts, or that is within the choices that you make with cereals. Also, these could be better choices that you make, right? Also, ensure that you understand the caloric requirement, right, from a perspective of the body, right? How much activity is happening, what is the weight, what is the height, what is the caloric requirement for, basal metabolic rate, as we say. That will also help us to create a better diet plan, right, for your father. But I think it's important that you take care of basic principles when it comes to choosing the right kind of food, and I'm sure that that will really help in the long run to help him with his sugar problems, right? There's somebody who has asked a question: does the patient need to avoid rice completely? In my opinion, no. It's a myth. There are a lot of things which have come in saying that, oh, rice will make somebody's sugar go high up. At the end of the day, it is about calorie deficit, right? Or calorie count that you're having. Say, for example, some people who live in the south of India, well, rice is the staple food, right? So suddenly, if you're going to change something, or somebody who is staying in the north of India and they say they're used to having rotis, and I suddenly change that and ask them to eat rice, that won't help. Having said that, the whole point is to reduce the carbohydrate intake, right? When I say carbohydrate, the amount of carbohydrates that are going in. So definitely, if you are going to have rice in breakfast, rice in lunch, and rice in dinner, and then it's going to be high in quantity, naturally your doctor would ask you to reduce it. So the principle is that you have a moderate intake, or rather low to moderate intake of your rice or any carb for that matter, and ensure that you have more of vegetables and fruits in your diet, right? That would be the crux of the matter. But by itself, to answer your question, does the patient need to avoid rice? No, I don't believe that. Yes, the patient can continue, but how much and how many times a day? That is the question to be asked and answered correctly. All right. There's also somebody who asked about how about custard apple? Is it good to have? See, all fruits are perfectly good to have as long as you have it in moderation, right? So I have a lot of patients who ask me, oh, can I have banana? Oh, can I have papaya? Can I have? It's all right for you to have all fruits as long as you ensure that it is taken in moderation, which means not more than a handful of fruit a day, right? Now, in your hand, when I say handful, in a day, you may be able to have one banana, a small banana, or half an apple, or about, say, 10 cubes of papaya or watermelon, So that is the kind of fruit you can take in a day, any of these, right? So which is a very small quantity. So ensure there is, and yes, custard apple, it is high on sugar, but there's no harm in taking it as long as you're taking just about half of it in a day. And that is the only fruit intake that you would have for the day. And that's perfectly all right for you to take it. So take it. But the key is to have moderation in the amount that you're taking. You can't overindulge in anything. I think that needs to be kind of understood by all of us, that the food, when it comes to diabetes, you can very well win over diabetes as long as you understand that moderation is the key, which means that you have to ensure that you can't go overboard with anything that you're doing in terms of your food intake, right? So that's the answer to the question. I hope I've given you some pointers to it. So going back to, like, how we can take care of ourselves in this Diwali. Of course, uh, I mean, this is a food for thought, and I have been seeing, though I've been mostly at home, but I've also been going out to my clinic and ensuring that I see outside and see a lot of people who are outside, who are, say, going out for shopping, and who are eating out, and who are meeting a lot of people. Well, all of this is great, but I see a lot of people who may not be using their masks correctly, who are not doing hand sanitization correctly, who are getting in touch with a lot of other people who can be potential carriers of the COVID-19 infection. And if you are a diabetic, right, if you are a diabetic, it is only going to make matters difficult. So ensure that you take care of yourself. If you're a diabetic, the best thing is to stay indoors, in my opinion, right? So that you limit the risk of exposure to COVID-19. I hope by now all of us know what is COVID-19, and the risk factors which, say, a person with diabetes has when it comes to COVID-19 infection itself. We are at a higher raised risk. Anybody who has chronic diseases are at a higher risk of getting the infection. So if you are going to, you know, ensure that you're taking the right kind of steps. If you're going out of the house, and avoid going out. If you are, avoid crowded places. Go to people and meet people who you know, or who are not strangers, because you don't know who you are meeting out, right? Or ensure that if you have symptoms, or if you know anybody who has symptoms, they need to stay indoors and isolated, right? It's as simple as that. But these need to be followed. I have seen a lot of people who have not been following these guidelines, and this can only make things difficult for all of us in this fight against COVID-19, right? So ensure that you're taking care of these points, say when you step out, or when you go meet somebody. Take care that you are following continuous use of mask, hand sanitization, physical distancing. These are very, very, very important to ensure that we are keeping ourselves safe, right? There are a couple more questions which have come in. That somebody asked, can we have eggs? Of course, you can have eggs. There's no harm. Eggs are very high in protein, so please do have eggs. One egg a day is a wonderful way to start your day as well, if you like doing that, or anytime through the day as well. It's a great meal option, right? How to arrive at the right insulin dosage? Very, very important question. I was going to get this to this question a little later, but great that you brought up. See, when it comes to the management of diabetes itself, we have basically oral medications which are available, and then there is of course insulin and some other injectables. But let us focus on insulin as you've asked for it, right? There are different types of insulins, right? So there is an insulin which we use, which is more like a short acting insulin, which the action of which will last only for a couple of hours. Then there is a medium acting, moderate, short to a medium acting insulin, which will last for about say 8 to 12 hours. And of course then there is a long acting insulin which is taken only once a day, and it's a 24-hour acting insulin. So the dosage of insulin is actually calculated depending on what insulin is being provided, and what are the ways in which the sugar fluctuation is happening through the day for you, right? So I think that is very, very important for us to understand, that um, how it is looking, like how the sugars are through the day. So your doctor would most probably figure it out when he or she is prescribing you. Initially, if they are starting off with insulin, they will give you a long acting insulin, and they will also give you maybe a very short acting insulin once a day to help you with uh, uh, help you with better sugar control, right? So that is something that we can do, right? So yes, but yes, the insulin right dosage has to be tightened depending on the levels of sugar that are coming through the day. So your doctor, when he or she is kind of titrating the sugar levels, he or she will definitely ensure that they are asking you to do your sugar test more often at home with the home monitoring sugar apparatus that you have. The doctor will ask you to do like your fasting sugars, 2 hours post breakfast sugars, pre lunch, post lunch, pre dinner, to understand through the day how your sugars are fluctuating. Once the doctor understands that, he or she will be able to put you on mostly a long acting insulin first, which is like a more 24 hours acting, followed by maybe once or twice insulin, which is short acting. There are certain other insulins which are available, which are more like mixed, right? Which are short acting and medium acting insulins mixed together. It's called 30/70, 50/50, if you've heard of these insulins. And they are provided again based on stabilization of sugars, right? So do reach out to your doctor, talk to your doctor, because this is not something that can be done in a day. Usually, the doctor will have to monitor the sugar levels over a period of time to arrive at a right insulin dosage. Okay. So there's another question about sugar-free tablets are good. Well, of course, there is nothing wrong in using sugar-free tablets. You can use it. It gives the artificial sweetener, and yes, it is a good thing to do. My personal opinion, and this is a very personal choice, I think everybody has a personal choice, but I believe that it's a good idea to just develop a taste for things without sugar. Even the artificial sweeteners also will have some amount of artificial components there or chemicals there, which we may if we are able to develop a taste without sugar, and which is possible, if we can, then I think that is a good idea to follow. And I think my recommendation is not to use it, but there is no harm in really going for sugar-free tablets, so you can use it. Okay. There's another interesting question which has come due to COVID. We are checking the pre and post diabetic checks at home itself. How accurate these readings are? They are quite okay. Yes, it's a good question. When you're using the glucometer machine at home, they give you more or less near accurate. There is usually a difference of about 5 to 10 points. But if you want to kind of monitor over a period of time, it's all right to have a good check. Okay. Now, but it is still recommended that you do once in 3 months HbA1c. I'm sure all of us know what is HbA1c. It is glycated hemoglobin. It tells us how has our sugars, how are the sugars for the last 3 months, right? How have they been? So if the sugars have been on an average good, then it only tells us that we can continue with the same medicine versus not. Now, usually the number for anyone who has it above 6.5 is known as a diabetic. A good control of diabetes, we usually say, is an HbA1c less than 7.5. But more than that, definitely requires usually administration of insulin, right? So it's a good idea that you do get the HbA1c check done these days. There are you could get these tests done at home so that you don't have to step out, considering the risk of COVID. You could have somebody who comes home and takes your sample. Of course, with proper precautions, you wear the mask, the phlebotomist wears a mask and all of that. But then it's a good idea to get your bloods checked once in 3 months time. Though, to answer your question, yes, they are near accurate. The home readings are near accurate, but they do not tell us the average readings, because these numbers are more to do with day-to-day fluctuations of sugar. And hence it's a good idea to do your blood test once in 3 months. All right. Do it at home. That would be, that would help you. Okay. Can we use millets instead of rice? Yes, we can. That's what I spoke to. Millets have higher amount of fiber. So yes, you can. The crux of the matter is still quantity. You still need to limit it, right? You cannot have, just because you're having millets doesn't mean that you have more. That doesn't work. Understand the calorie requirement, talk to a dietitian, and according to the calorie requirement, have the millets. But yes, they are a good option because they have higher fiber and content in them, right? There is a question which has come up this way. Can you put light on cases where patients who have been tested positive for COVID are getting diabetes after being cured? Doctor suggested it gets 99% in 2 to 3 months. Um, According to my understanding, there is no after results of somebody who, having suffered from COVID, would get diabetes. No, there is no correlation as such which has been seen, right? But of course, there is a possibility that there is already a familial history, that somebody in your family already has a diabetes, or you are already in a pre-diabetic state, right? So in that case, maybe it is so that it did come up post the infection. But there is no direct correlation between having been a COVID positive and then being diagnosed with diabetes because of COVID. No, that doesn't happen. But yes, there is a possibility if you were genetically predisposed to it, or you were already in the pre-diabetic stage, maybe you would show up as diabetes at some point later. The happening of COVID positive was just a coincidence in between that, right? There's a question which has come up about a medication which is to be taken, better to be taken before or after food. I think it's best that you would talk to your doctor about medications and how they are taken. Usually most medications should be taken with food. When I say with food, you're just taking the food and then taking the medication, because that is how the medicines work. The medicines help in better absorption of the sugar within the bloodstream, from the bloodstream into the other end organs. So take it with food. I would suggest that, right? There's a question about, what about sugar-free Chyawanprash? Yes, of course. If it is sugar-free and you're sure about it, you can take it. There's no harm in taking it. Yes, but make sure that it doesn't have sugar in it. I would suggest that, right? There's another question about HbA1c levels. Yes, that's a good one, right? With a value of 6.8 for diabetes, is it good to maintain HbA1c? Yes, absolutely. So as I was explaining, right, HbA1c is glycosylated hemoglobin or glycated hemoglobin, which basically tells us in the last 3 months, how have our sugars, average sugars been. Now, as I was explaining, anything more than 6.5 is a diagnosis of diabetes. So if you are at a 6.8 and under medication, then it is a fairly controlled diabetes. And that's a great job. If you have been able to maintain it at 6.8, that's great. Ensure that you take your medications correctly, ensure that you exercise diligently, ensure that you are controlling your diet well, because these are the things which will help you in maintaining the HbA1c, right? So it's good to know that you are maintaining it at 6.8, but continue the good things that you're doing already to ensure that it is kept under control, right? So I hope that answers your question. There's a question about some medication which I'm unsure because the spelling doesn't seem to be correct, but I'm presuming it is maybe a combination of two drugs, Glymiel M1. So, see, most medications do have side effects, right? Now, medications are different. By themselves, they do not have any effect on the kidney function. However, it is absolutely important that once you've been diagnosed with diabetes, it's important that you check your um, uh, basic bloods once in a year, right? So the way you check your sugars is once in 3 months, you do your fasting sugars, your postprandial or 2 hours after meal sugar, and an HbA1c. This has to be done every 3 months. But every year, it is important that you also look at some other things, some parameters such as creatinine, okay, which tells us how your kidneys are functioning. There's something called as urine albumin creatinine ratio. You also would want to look at your electrolytes, your liver functions, right? Sometimes even thyroids as well, and lipid profile, along with the hemoglobin. I think these are important tests to be done. Along with this, yearly checkup of eyes, yearly checkup of teeth is extremely important, along with nerve check to see if there is any sequelae because of diabetes, such as say retinopathy or neuropathy, right? So these are basic tests that you would do. Why am I saying this? Because this also tells us what kind of medications need to be provided. A creatinine check will tell us if we need to change your medications to drugs which are helpful or which will not affect the kidney, or rather are kidney friendly, right? So it's important to answer your question, is this medicine going to affect your kidney? No, not as such. But then if the kidney deterioration is already started and you already are suffering from a nephropathy, which means affection of the kidney as a result of the diabetes, then there are certain medications which cannot be given. So my suggestion to you would be talk to the doctor, get your tests done so that we understand how we can correlate it to be able to, tell you if you can or cannot take the medicine, right? That is how I would, that's what I would want to advise you. There is mm, there's a question about, please explain pre-diabetic condition and steps to avoid diabetes. Yes. So wonderful, right? So pre-diabetes is basically a condition which is before diabetes, right? Before, right? Which means that anybody who has their HbA1c levels, which are between say 6 to 6.5, we tell them as say pre-diabetic condition, which means they are not really completely diabetic, but they may reach the stage of diabetes if they don't do anything about it, right? So most people who are pre-diabetic, we usually do not put them on medication, right? So we usually would tell them about strict diet control, which means absolute zero sugars, or frank sugars, as we say, absolute control on having a diet which is low on carb, high on protein, high on fiber, right? That's something important. Ensuring that there is exercise, ensuring that there is, so if there is, if there is a scope for weight loss, then to work on weight loss. If there is any obesity there, taking care of that. Checking for other things, like usually with sugars, you will also see that there are people who would suffer from say high blood pressures or cholesterol issues or thyroid issues. So if checking for these issues as well, and ensuring that we treat for them, I think that's also very, very important, right? So we should do that as well, right? So from a pre-diabetes perspective, it is more a lifestyle kind of change. Understand that diabetes also has a component of stress involved, right? Stress is also something that can lead to diabetes. So if you are somebody who's undergoing a lot of stress, be it work, professional, personal, look at your stressors, try to work on your stressors, talk to people, get to a counselor, whatever is required to ensure that you work on your stress levels, right? So that is extremely, extremely important that you do that, okay? Now, the other thing that you must also be doing is taking care of your sleep, right? So if you are sleeping well, I think that's also something that will help in de-stressing you. Okay, so take care of that as well. Okay. From a pre-diabetes perspective, what I would suggest is ensure and look at your lifestyle, right? Well, first is work on your lifestyle. Now, some people are also advised medications in their pre-diabetic stage itself. These are the people who have very high risk factors, those who have already have obesity, those who have familial, running of diabetes in their families. So these are the ones who where we will use it more. Okay, so it's very very important that we look at it. Okay, it's very very important that from a pre-diabetes stage on itself we try to work at not getting to diabetes, right? There's a question about can we reverse diabetes? No, I mean, of course there is a possibility of reversing diabetes, but it is only when you take care of extreme measures to ensure that we reduce our weight, you take care of our diet, exercise. So yes, diabetes reversal is possible. There are a lot of um, extreme lifestyle changes that one needs to do, but usually most people who have been diagnosed with diabetes would end up um, having to be on some medication, if not a lot, to continue being on the, to continue, though they may reduce it to quite an extent, but they would have to be on some amount of medication for the rest of their lives. But yes, lifestyle changes can lead to a near reversal of diabetes. Absolutely possible. So if you are somebody who is working at it, I would want to say a great job done and please continue the good work, right? There is also a couple of other questions about sugar levels after fasting being 120, but post fasting it drops below 120. And that can happen, right? When I say post fasting, understand that fasting is usually a 10 to 12-hour fasting blood sugar level that we check, and post food, okay, it's usually 2 hours post meal. So if I've had finished my breakfast at say 9:30, I'll do draw my blood at 11:30, right? So it's a 2 hour post meal sampling, right? So it also depends on when the sample was taken, right? How much of the fasting was there, and how much of how much time was um, exactly calculated post the meal. Okay, so that is something that you will have to look at. Fair enough. So it is, yeah, definitely possible that after fasting it's 120, but post meals it is below 120. It is possible that it can happen. Please look at the timings when the sampling was done or sample was taken. Okay. So somebody has said that HbA1c below 6, but fasting blood sugar is at 120, 130. So it is possible, right? HbA1c tells us about the last 3 months readings, whereas the fasting is showing as 120, which is what happened yesterday, right? Depends on what kind of meal did you have yesterday, or it depends on how much time of fasting was taken into consideration before drawing the blood sample. So it is very much possible that yes, your fasting is showing as say 120, but your HbA1c is 6. So what my suggestion to you would be, in 3 months time, repeat your HbA1c to see if there is any rising trend. If there's a rising trend, definitely we need to do something about it, right? But at the same time, it's a good idea for you to develop, start off with good lifestyle modifications and take care of it. I think that is something that we all need to do, and we need to figure out a methodology to um, be consistent at it, diabetes or no diabetes. I think it's important that we take care of ourselves and bring in lifestyle measures on a regular basis more consistently, right? uh, there is a question on, is it okay for diabetic takes overnight soaked berries and raisins? Again, it comes back to the same thing, right? Berries and raisins are very high on sugar, so if you're going to have it, you need to know how much you have it. My suggestion is not to have it, right? Because they are very high again on sugar, right? How much will you have? It'll and if you start having like a handful, it is going to increase your sugar levels, right? So have the fruit directly. If you're going to soak it, naturally they are most probably dried ones. That's why you're soaking it. So have the regular fruit. That would be a better option, or a fresh fruit rather than having a soaked one, right? Is jaggery good for health? Yes, of course, jaggery is good for health, but understand that the sugar content in jaggery is almost same as the sugar content in our regular processed sugar, right, or refined sugar. So do not go by the fact that, oh, because jaggery is healthy for us, we can have it as much as possible. No, that's not right, right? Understand that the sugar content is the same in both. The fact remains that yes, jaggery A little less processed jaggery can also have a little bit of iron in it. It has a bit of fiber in it. So maybe it is going to help us in other ways. But from a sugar perspective, it is the same as refined sugar. So if you're going to have jaggery, ensure that you are having it in as limited amount as the sugar itself. So try to avoid it, I would suggest, unless you're using it to make a healthy option for, say, a sweet once in a while. Okay. There has been a question about explain about diabetes and heart diseases. Of course, see, diabetes over a period of time. What does it do? Right? It basically causes. It affects the blood vessels or the blood flow. It affects the nerves and the nerve health. Right? All leading to microvascular and macrovascular complications. Right? So, which means that a person who is a known diabetic has a high likelihood of having kidney issues, eye issues, or vision issues. They would have heart issues, strokes, or brain circulation issues. A lot of these things can happen. Okay, so it's important that first is to control the sugars, right? That's extremely important. And if you are a diabetic, then yes, there is an increased high likelihood that you may suffer from a myocardial infarction or acute heart condition is possible. So ensure that your sugars are under control, ensure that your blood pressures are under control so that you do not suffer from an adverse cardiac event, right? So that is extremely important that you take care of that. What are the symptoms of high sugar levels? Of course, I mean, I think that is something that we all know. Sometimes there can be no symptom at all, but if there are symptoms, usually they are increase in urination, increase in thirst, increase in hunger, change in weight, sometimes excessive increase or excessive decrease in weight, people who fall sick very often, repeated infections, urinary infections, chest infections, skin infections. These are usually the common presentations where the first time somebody comes up with diabetes, right? And then we check sugars and then figure out that, oh, it is because of the sugar problem, right? So it's important that we have our eyes and ears open for symptoms that you hear from somebody, or if you're feeling that you are having it yourself. Understand that many a times that might be no symptom at all as well, right? So we definitely recommend that if you're 40 plus, get your sugars checked at least once. It's important that you do that. It's good for your health and for the health of everybody else around you as well. So get yourself checked if you're 40 plus, right? There is a question on suggest fruits which can be taken. In my opinion, all fruits can be taken. Really, it's the quantity which matters. You have to have very limited quantity of fruit, just as I said, less than handful every day, but all fruits are fine if you take it. Certain fruits are very high in sugars. We typically try and tell people to avoid it. Say for example, mangoes or jackfruits or sapotas. But then that also is okay as long as your sugars are otherwise under control, right? The dictum is to ensure that you take very small amounts, right? That's how it should be. There is any homemade drink that can be consumed for lowering diabetes. Well, you could, so of course, there are a lot of things that are being that are told by in Ayurveda, right? About things like having gooseberries and things like having bitter gourd and bottle gourds and a lot of gourds. So these are all good. You can choose what you would want to have as a drink. If you're putting in any fruit, right, my suggestion to you is do not have fruits as juices, have fruits as fruit, because every juice will have more sugar and no fiber at all. So but yes, if you're having any kind of homemade drinks, you can have things like gourds, which are really great for having very low on calories and high on satiety, so you can have that. Having gooseberries is again very good. They are also helpful, high vitamin C, improves in improving your immune system, so that's also very good. You can have that, right? Hunger pangs, yes, hunger pangs can be difficult. Having healthy snack options, right? I think that's very important. Having some nuts or some seeds, having say plain popcorns or things which are, or say having a salad, right? Having cucumbers or carrots. These are all right for you to have as a snack option, right? They will definitely help you in taking care of your hunger, but at the same time not increase on your calorie intake. The point is this, though, I would want to ask, like, why are you getting these hunger pangs? Are your medications uh, more for you, right? Or are you eating less during your meal time? So check that out, check that out, get your diet looked at once by a dietitian, I feel. Also review your blood reports and review your medications. Is it that those many medicines are required? So maybe that's also a good idea to review medications, review your diet, and then see why you're getting hunger pangs when on medication, right? And then look for healthy snack options is what I would suggest, right? So basically I feel that um diabetes, see, one, we have to say that we have to win over diabetes, right? Diabetes is not something that is debilitating, that would that one feels that, oh, I now my life is over. No, it's not like that, right? As long as you make the right choices, as long as you understand that diabetes is here to stay, the cornerstones of ensuring that diabetes is under my control, right? I always say that it has to be under my control. How is that? Ensuring that I'm taking my medications correctly, ensuring that I'm monitoring my sugars correctly and reviewing it with my doctor correctly, ensuring that my diet, exercise, lifestyle, stress levels, everything are taken care of, right? And a fourth is, of course, ensuring that if there is anything that I have, I need to get back and talk about it with a physician or with my treating doctor, because that is the only way that we can keep, or rather conquer, diabetes, as I say, right? So take care of the fact that these are taken, looked at correctly, these are followed regularly, so that you know that you are going to have a hassle-free time, even during your festivities, right? I think that's very important. So during these festival times, ensure, okay, a couple of things that I would want to tell you. Ensure that you always have healthy snack options around you, right? Maybe like plain nuts, seeds that you keep with you, or salads that you keep with you, or some sprouts that you keep with you always, makhanas, or roasted nuts. These are the good things that you can have with you, to ensure that you have healthy snack options around you, right? Two, use natural sweets, right? When I say natural sweetness, which means that, make a carrot barfi, or use fruits, right? Or apple laddus. You can use any of these, or use banana or something. Use natural forms of sweeteners in your sweets that you would make, so that you have a healthy option of sweet itself, right? Three, definitely avoid alcohol, right? I would recommend that you avoid it, because it is not going to help you. It will only shoot up your sugars, right? Four, ensure that you are having your medications on time. Do not miss your medications at any point in time. If these could be oral medicines or insulin or whatever that you're taking, ensure that you follow that correctly. Do not stop it, okay? Five, ensure that even during the festive times, find those 30 minutes in your day, do some exercises so that you are consistent, right? Plan your day. If you know that you're going to have a heavy meal, ensure that the another meal that you have is very light. Ensure that you exercise a little more, so that you kind of compensate for the heavy meal that you're going to have, right? Six, definitely keep into mind that COVID-19 is here, right? Do not forget that. So, which means that social distancing, wearing of masks, washing your hands, these are important things. There are no two ways about it. Please, please, please take care of it, because you already have diabetes. So, this is only going to make things difficult, right? So, ensure that you take these 6 steps, and you will have a great Diwali. There is no reason why the festival of lights and hope and fun would be any lesser for you in these coming days, right? So oh, there is another question which has come in, right? um, what type of milk is suggested for diabetes, right? So typically we will tell, see, because most people who are diabetic also have cholesterol issues, which is called as dyslipidemia. And we always tell that it's a good idea to have toned or skimmed milk rather than having a whole fat milk, because it also contains a lot of fat, right? Which will increase the cholesterol levels. So have toned or skimmed milk, and that is more than enough to ensure that we take care of your the milk content, milk intake is there. There is calcium in milk, so it's good, of course. Have curds, have buttermilks, which also would help in giving you the kind of calcium that is required through the day. But yes, have skimmed or whole milk. That's a better option than having a full whole milk, right? There's a question about eyesight affected due to diabetes. Yes, eyesight can get, as I was explaining, there's an entity or a microvascular complication called as retinopathy. What is retinopathy? The retina, which are the back of our eyes, they get affected, okay, and they get affected in which there could be even the degeneration of the cells there, and that's why it can even affect our vision as well. So it's important that we take care of our eyesight. How do we take care? One is control of sugars. Two is ensuring that we do once a year eye checkup, right? This is very, very important, right? Three is to ensure if there is any other illness, such as high blood pressure or cholesterol, they need to be corrected as well and kept under control. Okay, if you do these things, then yes, of course, the eye problems will not come or they will be under check. All right. So great. So I think, we are almost at the end of our session. I think we have touched based on a lot of important points about diabetes, about COVID-19, and about what we can do this Diwali. So take care of yourself. Have a fun, safe, and a happy Diwali. Take care, stay healthy, and stay safe. Thank you. Goodbye.